Mother's Day. I see all of you smiling in the audience. No, I am not talking about that Mother's Day. You know, the one that comes with the flowers and the hugs. Not that one. Today, I am talking about Zambia's Mother's Day leave. A day that any woman can take off work, no medical report required. Zambia is one of only 7 countries in the whole world that has a menstruation leave policy. In Zambia, we call this day Mother's Day. The name itself is a euphemism, not necessarily because Mother's Day is all about mothers, but because even in this day and age, talking about periods and talking about issues that primarily concern women is still a taboo. And so Mother's Day as a way to talk about some uncomfortable truths in a manner that is polite. The intention behind Mother's Day was simple. Number 1, recognize that women's menstruation can affect them in the workplace. Number 2, acknowledge that women take on the bulk of childcare. And so, have this day that can be able to support the women. In fact, according to a 2017 BBC article by Kennedy Gondwe, and I quote, Mother's Day is important in our society because it acknowledges that women are the primary caregivers, whether they are married or not, whether they have children or not, end quote. Mother's Day breaks new ground. We must not forget that. We must not forget that Zambia did what very few countries have dared do, whether developed or developing. We became the first country in Africa to have menstruation leave as part of the labor law. It's also very clear that Mother's Day can offer relief to women. By having this menstruation leave policy, we were able to finally say that women's menstrual health and their triple burden, this being reproduction, production, and community managerial roles, actually deserves a place in the workplace and in the labor law. So we can all agree that this is a good thing, right? But at what cost? A few years ago, one of my direct reports took her Mother's Day off, and she took it on one of the busiest days of the year. Deadlines were flying, clients were calling. And as her manager at the time, I remember just feeling so frustrated. And if we're being honest, I was quite disappointed, and I thought her decision was irresponsible. But then I took a step back and I paused. And I asked myself, why? Why was I so uncomfortable with her choice? This line of questioning also led me to want to do a bit of research. As you know, by virtue of being a behavioral science researcher, evidence-based discussions and information is critical. So I started on my desk review and wanted to learn more. To my surprise, there was very little empirical research that had been done on menstruation leave, specifically in Zambia. And so then my journey started. I decided that I was going to do the research myself. This then became my master's in philosophy, specialized in inclusive innovation. And for the last few years, I spent time in 4 different organizations, talking to various people, ranging from senior executives, junior staff, HR managers, women, and men in the workplace. I also spoke to policymakers to understand from their perspective. And I also spoke to lawyers as well, just so we could really unpack what this Mother's Day is. And I'm going to share with you some of the research findings that came out. And of course, by virtue of being a behavioral science designer, I am inclined to use behavioral personas to share these insights with you. The first person I'm going to introduce you to is Natasha. Natasha is an entry-level employee. Natasha takes her Mother's Day religiously, without fail, every single month. And she uses this day for different reasons. Sometimes she uses it because she needs to take her child for immunization. And other times she uses it because she needs to rest. And sometimes she'll use it to do her hair. The research found that women used Mother's Day for various reasons. Then there is Mercy. Mercy is a mid-level employee. Mercy suffers from terrible periods. However, when it comes to using Mother's Day, she uses it very carefully. She navigates around the policy, not only taking the day when she needs it, but when it's convenient for the organization. For example, she never takes it on a Friday, never on a Monday, and definitely not before or after a public holiday. Mercy has learned to protect her image. And then let me introduce you to Grace. Grace is a senior executive. Grace supports Mother's Day leave, but she does so privately. She herself has never taken a Mother's Day, not necessarily because she wants to be harsh, but because she's trying to protect fellow women. Grace shared and said, "I don't take it because it's a way for me to prove to men that we're not lazy." The research found that 73% of senior women discouraged junior staff from taking the Mother's Day, not necessarily because they were trying to be harsh, but similar to Grace, because they were trying to protect the women. So what does this then tell us? It tells us that if you want to be taken seriously in the workplace, then bleed in silence. And lastly, let me introduce you to Thomas. Thomas is a department manager. Thomas supports Mother's Day. He thinks it's a good thing. However, he doesn't understand the boundaries around it. Thomas then shares, "Of course, it's a very good thing, but when 3 women in my department, when they take it in the same week, then productivity suffers. And so for time-sensitive things, I end up favoring the men." This sentiment was not uncommon. The research found that organizations did not understand the boundaries around Mother's Day. And then we also found that actually there is some stigma that women face, and it actually starts from when we're hiring or when organizations are hiring. It is very clear that the research paints a picture. The picture being painted is that even though very well-intentioned, currently Mother's Day or menstruation leave as it stands has unintended consequences. On paper, it looks great. However, the lived experience is a little bit different. And so what are we saying? How do we go further together? Do we completely remove Mother's Day? What if, just what if we introduced a wellness day for everyone? Would it help women to feel less stigmatized in the workplace? Would it help men to take on more of an active role when it comes to caregiving? And for women who are trying so hard to be strong in the workplace, would it then give them permission to take it freely, because then everyone can actually use the Mother's Day? I did go back to that colleague that I spoke about earlier. I went back and I thanked her. I thanked her because her decision helped me to ask some questions. It helped me to ask, 1, what kind of leadership punishes rest? And 2, what kind of a policy is wrapped around discomfort and silence? Real inclusion, real inclusive policies are ones that are not just written down, but ones that women and, the people that they're intended to serve can take and make use of without fear, without shame, and without penalty. I encourage us all to introspect within ourselves and also in our organizations. How are we handling the menstruation leave policy? How are we talking about it? And for my fellow researchers, we need more research that is from the global south. We need more research that is from Zambia. Let's look further into it. Let's open the conversations. In that way, Mother's Day, one day, will not be something that you need to be brave to take. It will just be ordinary.